Hey, I just want to share with you what we're doing here at our school and what we have a group called Treatment Team. And within our treatment team, we have a multitude of agencies and organizations and groups involved. And our whole purpose with our treatment team is to look at a picture of a child and to develop an idea of what that child's needs are, and then use our multitude of services and programs available to us in our school, because we have a full clinic complete with a nurse practitioner. We have an outpatient counselor. We have a day treatment program. We have case management. We have communities in schools. We have behavior specialists. We have behavioral experts, all a part of our team, where we meet every Monday at 8:15 and spend at least 2 hours every week using a proactive approach for the week before even the week begins. So we look at 10 to 15% of our student population who, as you would hear years ago, called at risk. We call them in need. And if students are in need, they can be referred to our treatment team through teachers, through any of our folks within our group of our treatment team. And then we'll take a multidisciplinary approach to really helping these students and look at a plan of action that we can develop for those students as we go throughout the school year.
I provide individual and group therapy for students that are in Highlands Community Services. I work with kids who are experiencing trauma, grief, depression, and anxiety, and I teach them coping skills and emotional regulation to help them be successful in school and in the community.
I am the nurse practitioner with Southwest Virginia Community Health System's school-based health clinics, which are located at Pelt Elementary and Virginia High School. We serve as an urgent care that is available to staff and students throughout the entire school system.
I'm a behavior specialist here at Pelt Elementary. I am here to support, or we are here to support, teachers, staff, and students. We get called on Channel 8, usually for some sort of classroom disruption, or if a student needs a break, or if they need to calm down, de-escalate, they can come to us in the Bearcat Pause area. They can go to the calm down room. And then after de-escalation, we can work on things such as, coping skills, social skills, of course, appropriate classroom behavior, impulse control, conflict resolution, especially in dealing with bullying.
We work with students in a one-on-one and small group setting using collaborative and strength-based approaches to really focus on building relationships.
I'm the school nurse at Pelt. I provide nursing care on a daily basis. I work closely with our special ed students and families to coordinate care. I am trauma informed, and I work with the treatment team to help coordinate wraparound services for our students. An example might be a child comes in frequently and doesn't have anything medically wrong, and then I start talking to them, and they might say, my mom died last year and I live with my aunt, but I really miss my mom. So I can then help coordinate care for them to go see our treatment team, mental health specialist, and stuff like that. So that's where I feel like I fit in on the treatment team.
My role with the treatment team is kind of unique. I see kids in my office for discipline. I see kids through child study meetings, eligibility meetings, IEP meetings. If I have a kid in my office multiple times for discipline issues, then I may bring that child to the treatment team to see what services they have and how we can support the teachers in the classroom. Also, if a student does not have special education services, then we may look at, does the child need to go through child study? What data do we have for that child? Would we have a reason to take the student to child study?
I am the Behavior Autism Coast First System. I'm serving all 4 elementary schools, and I've been working with behaviors for over 24 years. In my experience, I have learned that all behaviors communicate. My role is to support the team to provide the teachers and students the support they need to meet students where they are. My goal is to empower teams and support staff to understand what skills students are in need of learning to help them succeed in the classroom.
On the treatment team, I am a special education teacher. I work with kindergarten and first grade, so I can bring that to the team. Also, I am the child study chair. That means when we meet for child study teams that we are meeting to study the child. Anyone can refer for child study. That can include school staff or a parent. Most of the time when we meet, we are coming up with strategies and interventions to implement in the classroom to help the student. That can be for academics and for behavior. There's other times that those strategies and interventions aren't quite working, so we want to maybe recommend that student for special education testing, and then we can go on from there. And then all of that basically wraps up, and we bring that information back to the treatment team.
My name is Coach Z. I'm the PE teacher here at Van Pelt. I teach all the students here. What I bring to the treatment team is that I've created an archery team for 4th and 5th grade students. We've created Bear Kittens cross country 1st through 5th grade team, and we also have created a Bearcat All-Stars reward incentive trip at the end of every 9 weeks. Our top students get to go on that trip if they have positive behaviors, grades, and attendance.
So I provide therapeutic day treatment for the treatment team. I do this with individualized students through a school-based program that addresses mental health issues, emotional issues, and behavioral issues that may create a barrier to their effective learning within the classroom. So I provide intervention services. I focus on behavior management, academic improvement, and life skill development by implementing individualized social skills for each child that I see and that qualify through services through Highlands.
Communities and Schools of Appalachian Highlands is dedicated to surrounding students with a community of support, empowering them to stay in school and achieve in life. Communities and Schools of Appalachian Highlands connect students and their families to basic and critical community resources tailored to each student's specific needs. We work inside the school building every day to remove the barriers that prevent student success in the classroom. We provide support in social and emotional learning, behavioral interventions, academic assistance, physical and mental health referrals, community partner engagement, family engagement, life skills, mentorship, college and career prep, basic needs, and enrichment. I contribute to the treatment team by giving updates and information of my case managed students that I work with monthly and daily.
Hi, I am the school counselor here at Van Pelt Elementary. Notice I said school counselor and not guidance counselor, as that is an outdated term to describe what we do. And that is work with stakeholders and other key players in the school, providing short-term counseling with also referrals, if necessary, for long-term therapy. It's more of a proactive and preventative approach, working as a team, collaborating, and teaching knowledge, attitudes, and skills for academic, career, and social-emotional development, provided through individual, small group, and whole class counseling. So the description I find helpful when trying to explain it to people is to use the medical field as a metaphor. We are like the primary care or general practitioner. If everything is fine, you might see your primary care once a year for a checkup or an annual review. If you have an issue, you would call, and if it was minor, it might be fixed right then, or you could go back for a follow-up or two. But if a more chronic or serious problem arises, you could be referred to a therapist or another specialist. Maybe your problem is serious enough that you go to your specialist regularly and they're your first stop. But even then, your primary care is usually looped in.
I'm the case manager for Highlands Community Services. A case manager improves the well-being of children and families with behavioral health needs. We do that by monitoring, linking, and coordinating the appropriate services to meet those needs. I help assess students to determine appropriate services, and I monitor those services to ensure that we are effectively treating our students.